Good morning, everyone. Good morning, everyone. I'm Laura Brunner. I am the Lethbridge Local Immigration Partnership Coordinator here at Lethbridge Family Services. I am excited to welcome you to our webinar this morning. Before we get started, I'm going to put Noor, I don't know if Noor, our Lethbridge LIP admin, if I could call on you, Noor, to do the land acknowledgement, if you don't mind, before we get started.
Hi, good morning.
Sorry, Noor.
We are gathered on the lands of the Blackfoot people of the Canadian Plains and pays respect to the Blackfoot people past, present, and future while recognizing and respecting their cultural heritage, beliefs, and relationship to the land. The city of Lethbridge is also home to the Métis Nation of Alberta Region 3. Thank you.
Thank you, Noor. Okay. So just to let you know that this webinar is put together by Lethbridge Newcomer Health Advisory Group, and they are also a working group of our Lethbridge LIP partnership. Sasha has been very instrumental in chairing that group for many years, and her work around COVID has been exceptional in the community. And so add anything you'd like here, Sasha, but the purpose of our webinar this morning is to take a look at how COVID has affected and the impact that it has had, especially on our newcomers. And we are going to welcome 4 presenters that have different perspectives on that, all that are very meaningful and have some really good information, and allows us to kind of regroup and look at maybe the positives and what really happened in that process, and how we managed as a community, and maybe some steps forward. Sasha, do you want to add anything before we get started?
No, I think you're good. Thanks, Laura.
Okay, I don't have the order. I'm going to go with the order that I have, and that will be Sean, followed by Tadar and Denora and Santosh. Is that okay with everyone? Okay. So I would like to first introduce Sean Robinson. He started his career in environmental public health with the Calgary Health Region in 2002. And a year later, he moved to Lethbridge to work as a public health inspector with Chinook Health. With Sean's interest in water quality and health impacts related to land use developments, he came to the Chinook Health Region drinking water officer, and he became the Chinook Health Region's drinking water officer, sorry for that, in 2007. In 2010, Sean became a supervisor with Alberta Health Services South Zone and remains in this position today. With almost 20 years of frontline public health experience, Sean greatly values strong community partnerships and collaborations to promote and protect public health in Southern Alberta. Sean has been very instrumental in the community COVID huddles that have been arranged through Stasha, and he's been to most of those. So, Sean, can I will welcome you and turn it over to you.
There you go. Can you hear me now? Yes? No?
We can hear you.
Yep. Yes, we can hear you. Welcome, Sean.
All right. I'll just get into the presentation here. Thank you very much for that introduction. Yes, we had some wonderful experiences with COVID, and that did obviously give us a lot of trials and tribulations. And I'll give an opportunity here to kind of go through some of what we experienced during the COVID. I'll give you the perspective of a health inspector and what we learned through this process. So everyone can see my screen here. We'll start off with basically when we first caught wind that something was going on. Going back, you'll a little bit of a time in history, you'll remember that in late 2019, we became aware something was going on out of Asia. We didn't know much about it at that point in time. We just knew something was definitely on the verge. We have seen other diseases that have come out of Asia, but what we were noticing this time, something seemed different, and it wasn't very late into early 2020 when we realized that something is definitely going on. I got a picture here of an example of some of the information that we were receiving. Is they're welding the doors shut on apartment buildings in China, which makes you wonder what on earth are they trying to keep in there. We were getting reports of medical staff in Italy succumbing in great numbers to this new disease that was ravishing the healthcare system and Italy. So we knew something bad was coming our way. We didn't know what was going on, but we knew it was serious. And in the province of Alberta, we've been planning for pandemics for a number of years. We've known for some time that there's a cyclical pattern to pandemics. We know probably the most or the gold standard that a lot of people compare pandemics to would be the 1918 Spanish flu. But there have been smaller, and when I say smaller, I mean just number of deaths from since 1918, but we haven't had the big one. And we've always been trying to say, yeah, get ready for the big one's going to be coming. Get ready for it. Get ready for it. And for the longest time, and I know even myself, did I get lulled into a false sense of security that maybe I might not see the big one in my lifetime? I'd be lying if I said I was ready for this one. And I think a lot of people were that. I think we were, if you look back at the 2009 H1N1, Alberta did have some deaths. We had 72 deaths that year during that pandemic. But the biggest thing that I remember that was the whole Calgary Flames fiasco and the queue jumping of the Calgary Flames to get their vaccine shots first. So,
Sean, your slides aren't moving.
They're not moving. Oh.
There we go.
Maybe I'll just do it from this perspective here. Does that work for you guys?
Yes.
Okay, so this is just basically showing the different pandemics that have occurred throughout history there. And you can see that there have been a number of pandemics. Like say 2009 was the one that we had previously. But again, the one that a lot of people measured compared to was the 2018. And we've been planning for some time. So I won't go into a full history of what happened after March 2020 when the COVID ended up here in Alberta. But I will reference this. This is a great little article that I came across from the Calgary Herald that gives a really good timeline of things. It was kind of interesting to go back and look at how what happened, how we responded, and how things worked out. Very interesting. So I'll flag that there. But what I will flag for you here is what we see is this is our total case counts as we went from the beginning of this pandemic until current date. And you can see a series of waves. The first wave is very, very small. But the one thing I'll draw your attention to is as case counts went up and public health measures were put in place, cases went down. Cases, the restrictions or the public health measures would be removed, cases would go up, measures would be put back in place, cases would go down. And we went through this cyclical pattern. Right now we're on the 6th wave. So if you want to go back and take a read through some of the history of, we went through just a good little article for that. But what I will highlight in this graph here is that very first wave there. I'll get you to look at that one just after April. Just see how small that one is compared to the last two waves here. And these last two waves are not truly representative because this is a very small portion of the population that we're testing at this point in time. So what was the role of environmental public health during the pandemic? Well, we had the enviable role of being the regulator and the enforcement branch of the healthcare system. So when Dr. Hinshaw here would give out or announce a new public health chief medical officer health order, we would be the agency, one of the agencies. There was multiple agencies that did have enforcement capacity, but we were tasked with trying to regulate and enforce that order. The other things we did, we supported outbreak management for congregate care sites, shelters, child care centers, and one big portion was our work sites. The other thing we did was support municipalities. There was a lot of questions and information flowing that was trying to relay information from the health side of things down to a municipal level so that decisions could be made. And as an example, we have the need for an isolation and quarantine hotels in the province here. So what were some of our challenges that we experienced? Well, yes, there was definitely lots of challenges. Remember how I showed you that first wave, how small that wave was compared to the other waves. Sometimes your successes can be held, you're basically almost guilty of your own success. And that's what we found in that first wave, was the fact that a lot of people would say to us, well, hardly anyone died. There was no issues there. We're just going way above and beyond. Hardly anyone died. And that was thrown in our face multiple times. They looked at how restrictive those public health measures were and that hardly anyone died. So from there was this perception that this was overkill, that this really isn't an issue, that we're bringing a bazooka to a knife fight, so to speak. Another issue was what we call the 330 Government of Alberta bomb drop. We weren't privy to the discussions as to what the decisions would be by the government. We were just left with the results after the fact. So the government would make the announcement, this is what's going to happen. And we were like deer caught in the headlights. Our phones would light up instantly and saying, what does this mean? We didn't know. There was a lot of confusion. Sometimes it would take up to 2 weeks by the time we coordinated with government to figure out what the intention was by some of these sections of the orders. So there's a lot of confusion related to that. Another challenge we had was enforcement. A lot of people don't realize that as public health inspectors, we're not peace officers. I can't issue a ticket. And so sometimes when we got ourselves in a situation where we're trying to compel someone to follow the rules and they flat out tell me, no, get lost, I don't have a lot of tools in my toolbox to force someone to comply. What we do have was take them to court, which is a long, very exhaustive process. And the other issue that we had because of the court, there was a constitutional challenge that was put forward very early in the pandemic on these public health requirements that were put in place. And because that constitutional challenge, everything stopped. They had to have that constitutional challenge first, which basically handcuffed the entire system, the court system. The other issue is orders were changing so quick. You would issue an order and all of a sudden the order would be rescinded. So all those tickets that had been issued, they were just like, you know what, the juice isn't worth the squeeze here. Those tickets were waived. So enforcement was a big challenge for us. And the thing we were fighting was that we had multiple fronts that we were trying to combat. You can see here we're not only fighting the virus, but mis and disinformation was a real challenge for our program. And I think that was just a great challenge for the province in general in trying to respond to a pandemic and make sure our information was the information that was being heard. The other component that we had to challenge was pandemic fatigue. There was a lot of people that at this point in time were tired. They didn't want to do this anymore. They were feeling that this was, they didn't realize how long of a battle this would take. They didn't realize this was not a sprint, but a marathon. And the unfortunate part was that a lot of people started to give up at times. And that made things very challenging for us. And when I've said this before, is that it was a marathon, but unfortunately at times the healthcare system was forced to sprint the marathon. And that led to a lot of burnout and troubles for the healthcare system. And so one of the things that we found was really challenging is that you have very varying levels of risk acceptance and risk tolerance. Here's two examples of probably opposite ends of the spectrum, but you're trying to find a balance somewhere in there. The balance between the collective good and your personal freedoms. And that was a real struggle to try and find where we can draw that line in the sand, because there was such divisive, very polarized opinions on this. And it ultimately came down to the cost of the society versus the COVID death rates. We did see obviously different pockets of the population that either bought in or did not. And definitely, you probably remember the rodeo circuit that came out of the gates early while the measures were in place. There definitely was a divide between rural Alberta and their experiences with COVID, or their perceived experiences with COVID, versus what the rural settings were experiencing. And it very much pitted urban versus rural sometimes. So again, some of the challenge we had is that COVID didn't become a concern until it affected me. Once it affected me, then holy moly, now yes, put me on camera and let me talk about this, because I will tell and I will convince other people that this is a problem. We've come across that multiple times, is that I don't want to be impacted until I am impacted. Then holy moly, I got to spread the message to the world that this is serious, this is real. And we know that in the fog of war, mistakes will be made. Obviously, there's a lot of confusion. There was a lot of information that we were trying to take in and make proper policies and decisions on. And we know that sometimes maybe the best approach wasn't taken. Just a quick example, I could think of masks. Masks in swim pool. We were told that pools have to wear, persons at a pool, they have to wear a mask. Well, how does that work? If I'm going to go swimming, how am I going to wear a mask? It's asinine. So obviously there were some things that had to be worked out, but unfortunately some of those things that happen does attack your credibility at times. And the whole debate on vaccines. As you can see here, the pictures, we started off with people fighting for the vaccine, saying we don't have enough, to the point where we're trying to incentivize it and giving people money and eventually having to implement a vaccine passport system, because we just could not get people to accept and take on the vaccines. Later on, we started to see situations where we're realizing that, immunity is waning, and a lot of people have been throwing in our face, oh yeah, we need another dose. I need another dose. When will it ever stop? So again, all these things compiled were definitely challenges for us. And one thing I will point out here is, because this was thrown in my face multiple times, is a lot of people say, well, you're too young to remember. But thalidomide was something that was very serious. When things get rushed through, mistakes get made. And trying to convince people that there was good, solid science surrounding the vaccines was very much a challenge. So obviously, we found ourselves in conflict multiple times. Now, there were times where people would give us kudos and say thank you and appreciate the work that we're doing. A lot of the people that were contacting us, though, were not calling to say, hey, how you doing? We had a variety of phone calls that came into us, threats for jobs, lazy government employees, destroying business. I think I had someone call me doing the devil's work. People trying to find out how they can circumvent the rules. We were finding ourselves in a lot of conflict. And the conflict was starting to get to the point where it was very concerning to our team. And I know my director, who was here at the time, was very concerned about what we're seeing on social media, how healthcare workers were just the vitriol attacks of our colleagues on social media, And we knew it was a matter of time before something bad was going to potentially happen with our colleagues. So what did we learn through this whole process? Well, harmonizing a common approach is very tough. We know that there's just varying beliefs, varying knowledge and supports that people have, and it's very tough to get people on the same page. And we definitely found that communication was very important, and there was lots of confusion. Things that we didn't even understand how they happened, like the great toilet paper shortage of 2020. How that actually happened, we're not too sure. But we know that at times we were confused from the healthcare's perspective, that if we were confused, obviously the general public would be very confused as to what's going on as well. And it came down to the fact that we needed to try and fight that misinformation that is being just run rampant on social medias. The tough part with us is that slow and steady will win the race, but it's very tough during a pandemic, especially when you're in a province of like Alberta, where it's just roll up your sleeve and get it done type attitude here. We have to take in the information, evaluate it, study it, replicate the science, and good science takes time. And as you learn, you might adapt and change your approach. The problem is that when people see that and they're not familiar with how maybe the science path works, they see us as flip-flopping and changing and not providing good information. And that was very much a challenge. In order to take that, to make the policy, we needed good science to guide the decision makers. The problem is we're the ones playing by the rules. On the other side, I can decide that, throw some ivermectin in your beer and you're going to be free from COVID. And that messaging just got sent out. And unfortunately, a good portion of the population gravitated that based on the sale of ivermectin in Southern Alberta. We did have a lot of people that were buying into that concept. And when you're trying to play by the rules, but the other side isn't, you got one hand tied behind your back. Probably one of the biggest things that we learned through this was that we're not all in this together equally. We know that there was various groups that were heavily impacted compared to others. And I have this it's a beautiful little schematic here from Health Commons. It talks about the social determinants of health and your impact on health of the population. And we know from our experience here that new Canadians, visible minorities, women, multi-generational household, the elderly were disproportionately affected by the pandemic. We realized that wealth means health, and the pandemic confirmed that. And this last statement in this box here, where it says the pandemic is exacerbating the effect of these inequities, particularly for communities who are already under-resourced and experiencing barriers. And I think that really highlighted it for us, is that we knew that there was communities that were definitely impacted from a health perspective, but you throw COVID on top of that and it's just exacerbated it. So our creative approach, our success comes from building strong relationships and partnerships that we have in our community. And we identified that in order to succeed, we're going to have to try and leverage those supports and those connections. So we can identify what are the gaps and the barriers for that community, provide that credible information, and empower that community to help themselves. And I do have a shout out to Santos and Kamal, just with the Bhutanese experience that we went through that really solidified that process for us. The one thing I will add to this is what we did learn is that you can't enforce your way out of a pandemic. You either hopefully have people that will empathize and have a thought for the greater good, or you have people that maybe have more of a self-centered thought process. Hopefully through targeting different individuals that have influence, we could try and sway discussions and thoughts for the greater good, rather than that self-centered approach. We also realize that sometimes the talking head from the government is not always well received. It may not be as trusted. There might be some hesitation. We know that if there's people in the community that have greater trust and greater impact, if we can have them making sure that the proper information and the correct information is being shared, we would have that better buy-in. Plus, we'll also have a reciprocation of information from the front lines back up to the healthcare system, so we can identify what are the specific needs. So sorry, this was very quick. I was trying my best to stay within that 15 minutes. I don't know how close I was here. But in conclusion, I'll say this: I never want to go through this again. We know that we're not fully out of the woods yet. There's always going to be new variants that will come along, and we know that there will be future pandemics. We also know that from this pandemic, there will be some long-term effects that we have to work through. We know that there's long COVID. We know that there's some mental health barriers that we have to respond to. And we don't know the long-term effects yet of COVID. We'll be playing those out as we go. For example, HPV virus that is linked to cervical cancer. So there's things that we don't know yet that we'll have to continue to learn as we go. We know that the healthcare system got kicked hard, and there will be some ramifications from that. Sometimes when you're down on the mat, you don't get up as quickly as one might expect. So there will be some impacts from the healthcare perspective. But the learnings that we have from this will hopefully benefit future pandemics, so that we hopefully have better outcomes and success. And I'll leave it with one comment here: is that, you know, the old adage says it takes a village to raise a child. Well, we also learned that it takes a village to get through a pandemic. So thank you very much.
Thank you, Sean. Wow, it's very interesting to go back and look over those 2 years, and I really appreciate you consolidating that for us, and also makes me feel very happy to know that folks like yourselves are on this, and you were always there for us to answer questions. And I can't imagine how difficult this was, but this is really excellent information, and I really appreciate it. We are going to save any questions at the end for you, Sean. Again, this is excellent, and I really appreciate all the work that you've done, as well as encapsulating this for us. I think it's important to look at it from that whole 2-year period. Thank you very much.
Thank you.
Okay, so we're going to move on. Our next presenter is Tadar, and Tadar is one of my colleagues here at Lethbridge Family Services. Tadar has more than 10 years of experience working with refugees and immigrants. Currently, she is working at Lethbridge Family Services as a settlement practitioner. Tadar joined LFS in 2015. And before that, she was working in a settlement agency in Surrey, BC. While studying at York University, she was working as a peer researcher in refugee youth and mental health research project with an organization named Access Alliance, Multicultural Health and Community Services in Toronto. She is very passionate working with refugees and immigrants because she shares the experience with them. She was a refugee from Thailand before coming to Canada. In her free time, she likes to cook and spend time with her family. She also does volunteer work with the Red Cross and her own ethnic community in her free time. Welcome, Tadar.
Thank you, Lauren. Good morning, everyone. Thank you for having me today. For my para presentation, I will be talking about how pandemic impact on settlement works and how it affects on our newcomer and refugee clients in different stages of their settlement process. First, I would like to talk about how it affects on the initial state of their settlement process. We are funded for resettlement assistance program, which we help newly refugee arrivals to get their immediate needs. met during the 6-week period. During the 6-week period, families are placed in temporary accommodations, and we assist with looking for permanent housing, applying for healthcare card, banking, social number, and applying for any provincial and federal government program. And we usually place the newcomer arrival in motel with kitchenette for the temporary accommodations. Since COVID started, new arrivals are required to quarantine for 2 weeks in temporary accommodation, which delay the assessment process, which also means that they have to stay longer in temporary accommodations. It's really hard on our family member to share small hotel room with children and not able to go out and have outside contact for 2 weeks. We also face challenges to find housing for newcomer during COVID. It's generally take us 20 days to find housing, but now it takes 42 days in general to find house. And it was difficult for a while without able to see in-person viewing due to the COVID restrictions, and it takes twice as longer to house newcomer, and which means they have to stay even longer in that temporary accommodations. So to make sure their mental health are well taken care of, our team member, we make regular check-in with clients and meet client outside hotel in parking lot area to give them some fresh air time, play time for the children during quarantine. The newcomer are also required to have 8-day and 14-day COVID testing during quarantine. Staff members are expected to monitor with very little directions given by federal and provincial government. And so it added extra work and extra stress to the staff member to check vaccine status, COVID testing for each individual. And then we also have constant changes on vaccine rules and quarantine rules that increase stress for clients and staff members. Fortunately, we have good collaboration with our Lethbridge public health team to monitor the test, and we are very grateful for that. Due to the travel restriction, we also received many last-minute arrival cancellations and sudden change in plans with very short notice, so it added a stretch to our staff member. As we are aware of flight cancellations in Lethbridge during COVID, newcomer refugees are now required to take taxi to come to Canada from Calgary. So it increased their travel time on top of the international travel time that they already have to reach Calgary. So by the time they got to Lethbridge, they are totally exhausted. The positive thing come out of it is that government now recognize that the need to have a bigger space for temporary accommodation during quarantine period. So we are granted for funding to rent 3 apartments for newcomer to use as a temporary accommodation, which give them more space and a little bit of outside area that they can spend to have a fresh air during the quarantine period. And after 6 weeks, now new immigrants are moved to the new stage of the assessment process. In this stage, they usually will attend orientations. We provide orientation in different topics to learn about Canadian culture and Canadian system. After that, they are required to learn English and look for work after 1 year. They are only financially funded by IRCC for 1 year from the day that they landed. Due to COVID restrictions, group orientation were not possible, and we have to do individual family orientations, and it take longer and take more resources, both staff member and interpreter to provide orientations. And the group orientation also provide opportunity for newcomer to meet with other newcomer family and to make a social connections, but it was taken away because of the COVID restrictions. And after the orientation sessions, they are now planning to attend language classes. Before going to language classes, they require to do the language testing. Fortunately, at that time, our language testing center was closed down in Lethbridge, so they moved to online testing. So it is not effective for our clients with low English skill level and lack of computer skill to take the test properly. And it also taken longer time to get the appointment, which made them delay on attending the English classes. During COVID, for a while, language classes were closed, so they are moving to online class system now, and so the clients are required to take online class. It is really challenging for our clients with very little knowledge, technological skill, and also not able to access to computer due to the limited income. It is more effect on the single mom and newcomer woman to study at home with younger children. Without able to attend in-person classes, also create social isolations and less community connections. So most immigrants depend on their ethnic community for social support. To make the matter worse, for a while, and changes in busing system in Lethbridge require a rider to pre-book over the phone or online. For newcomer, busing is the only source of transportation. They now are facing challenges to take bus to do grocery, to visit friends or work. Busing system or booking system are not designed for newcomer and are not accessible for newcomer due to their language barrier. So they heavily depend on our office to do grocery, to book the bus. The positive thing come out of it is that we have now collaborate with Lethbridge Transit System to organize like training sessions for newcomer and teaching them a bus route regularly. While parents are facing those challenges, our newcomer children are also having challenges at school. As we know, our newcomer family tend to have bigger family compared to the native Canadian. Parents are not able to afford to provide technology for children due to the limited income. Children do not have access to computer or quiet space to study. Most of the time, family are not able to afford to upgrade high-speed internet that require for the classes. Even school provides some devices, school were not able to provide with technological support to get into the online classes. And due to low educations and language barrier, parents are not able to support the kids with the online learning. So not only only newcomer children are disadvantaged in academics, but it also affects their social skill. There are some children having difficulty bonding with peers due to the isolations, even after the COVID, when the school opened it up. During COVID, the amounts of call we received from school were very high. School we call Lethbridge Family Service to book COVID testing for children who is showing any COVID symptom. Children were sent home and parents were confused because they were not properly explained the reason why. In some cases, the student will show up at school without knowing that they are required to stay home because they were identified as close contact. So those insufficient communication create anxiety and increase stress on both students and parents. And our youth settlement team closely working with school district and provide assistance to effectively communicate with parents. We also provide a support to parents with online learning by guiding them how to get into the online classes and delivering books and homework to their home. As I mentioned, government-sponsored refugees are financially funded for 1 year from the day that they landed. When the time come to look for work, we find that many clients were not ready due to the interruptions in language learning and limited employment support they received during COVID, and it delayed their job searches. And now people who do not have a job and were done with the government system program, they have to assess income support for financial support. So we help them to assess to those support. And fortunately, As we know, Alberta Ward office is closed down and they moved to online service during COVID. So it created more barrier for clients to access service. When the office was open, it usually take 1 week to receive benefit. Now it can take up to a month to receive the benefit. They are required to call or apply online. So it creates more barrier for our immigrant and added more stress to the family. And during COVID, we find that anxiety level and stress increase among clients those who are already been working because of sudden change in COVID rules and frequent outbreak at work. Most of our new immigrant clients work in hard-hit sectors such as meat plant and hospitality industry. They were sent home due to close contact and required to stay home for a few weeks. And most of them do not understand how to apply for a self-program or EI. And these programs are not designed for our clients to easily access due to their language barrier. Pandemic also affects significantly on our mentorship program, which support foreign trained or internationally educated clients with their employment in Canada. There were very limited in-person interruptions and networking opportunity for clients, and also limited job placement opportunity to gain Canadian work experience during COVID. For the conclusion, find that all in all, we find that our clients are very resilient throughout the difficult time. Our services are more innovative to adapt the change and the challenges. And we find that more increase in clients using technology to access service. And we also have more and better collaboration with community service provider. And these are the positive outcome results from the pandemic. And this is the end of my presentation. Thank you for listening.
Thank you very much, Tadara, and thank you for all your work and the settlement team's work. I think that it's very challenging work in without COVID, and then to add that pressure and people coming in into Lethbridge, working on settling and then having all these barriers. And so I know being in the office, you guys did a wonderful job, and appreciate that, and appreciate you sharing your experience as well as all the wonderful work that you do. Thank you, Tadara. Again, we'll save some questions till the end. Our next guest I would like to introduce is Denora. I know Denora quite well because she works with our immigrant advisory table as well. Denora is from Mexico. She has been working as a leader of Mexican Alliance Lethbridge for the past 3 years. She is very passionate to support seasonal Mexican temporary foreign workers, TFWs, and Latino community for different needs such as interpretation, advising, and settlement. Denora is also a member of our LIP Immigration Advisory Table, which we appreciate. Denora works for an accounting firm as a Spanish marketing manager, and she is also a member of Southern Alberta Ethnic Association as Mexican Alliance Lethbridge membership. Denora is an English-Spanish interpreter who supports TFWs in different farms and greenhouses around Lethbridge. She's also a member of CKXU Radio, University of Lethbridge, Board of Directors, and as a host of Spanish radio program. I'm not going to say that name, Denora. My Spanish would, not be. For the last 2 years, she has been part of Health Coaches Group for COVID-19, representing Mexican and Latin community. In 2021 and 2022, she was part of a team that that helped with the vaccinations of COVID before they went back to Mexico, and she was a great support to those people as well as to the COVID a group that was meeting. So we're looking forward to your perspective, and welcome, Denora.
Well, thank you. I'm so happy to be here. Gracias por invitarme. Thank you to all Stasha team and all this group that support all the community in this pandemic. I'm going to start with this sentence. Spanish is one of the main language the people in my community use to communicate. But this Spanish is the base of communication for temporary foreign workers. Since I started being part of this health group, my main goal with my small group, Mexican Alliance Lethbridge, is to support my community in our own language, Spanish. It's the best way to understand everything. And the idea in this pandemic was to just do that. The main challenge that I found, it was like more than working with a normal community, I just always take care of the temporary foreign workers. And this challenge started in Mexico when they decide to come to this country to support any industrial companies. They work in farms, cattle, beekeeping, and they come to just get all the food that we have, harvest, and all those kind of jobs are really hard ones. They have to leave their family for almost like 6 to 8 months every year, and they come to Canada without any information and without any English skills. Some of them, they have like slow English skills, but it's not really common to have them. When I just started joining this group, I decided to support them because there's the less people that is being counted. And when we talk about temporary foreign workers, there's another level that it's temporary seasonal foreign workers. And those are who are in those places far away from the city where they have to work between 8 to 12 hours daily, even Monday to Saturday. So when I decided to just approach to them, what I did is that I went out to all the places in the city, especially Lethbridge, to catch them and ask them if they already have been vaccinated. And they didn't have any idea about what to do, where to go. So I started planning with them, and well, a little bit before, I started looking for different organizations in Calgary and see if they can support them to have the vaccines, but I didn't got any answer. It was really complicated because it's 2 hours from here, and those organizations, they don't have an idea how these people lives and how they work, and they don't have the English skills, they don't have any information from the owners. So when they just arrive to Canada, they just go to the farms, start working, and they communicate between them. At least maybe few people speak a little bit Spanish in those farms and try to help them, but it wasn't enough. So I went to different stores and places here in Lethbridge and around areas to see if I can find those groups. And yeah, I have the chance to work with 5 different farms. And with the support of Stasha, Sean, and the health group, we have the opportunity to give gave to them the first doses of the vaccine for COVID-19. Unfortunately, for this time, the companies or the owners, as well as the managers and the supervisor, they were not really happy that I approached to them, because in each farm they have their own rules. Sometimes they don't follow the government rules for accommodation. They don't follow the rules for payments or hours they have to work. So it was a little bit complicated to approach to the farms. 5 of them, they open a little bit, but 2 of them, they say, no, we don't want the people to get vaccinated, because we don't have any idea how they gonna be reacted. And so I couldn't work with those. But the other 3, I got like around 80 temporary foreign workers to got the vaccine. When this happened, it was a challenge because they don't have a health number. They come into Canada with our insurance, but it's a private insurance that government pay for them, but it doesn't cover any kind of Alberta health service. So they got the vaccine because it was really needed, and Stasha, it was a huge support when I decided to support these groups. She helped me to book an appointment for 48, 50 temporary foreign workers. We had to travel to Fort McLeod because it was the only place where they have the vaccines. It was awesome experience. And I hope you have the time to watch one of the videos that Stasha shared with all of you. When they just arrived to that clinic, they were like, oh my God, they were so happy. They feel like someone is caring about them. They just been ready, open to get the vaccine. Doesn't matter if they will have any side effect but they want to get the vaccine. At this time, it was like 2 or 3 months that the Filipino community in that farm were vaccinated, and they, excuse me, and they, the Mexican group didn't have any information about vaccines. So they have to work with masks, and they didn't allow to go around town. At the end, we got the vaccines, and for the second time, Stasha support us to got the health number. So it was easier to get the second vaccine. And this time we continue just having the vaccination for those temporary foreign workers. The challenge that we have, and I'm saying we because we're working together, them and I, is the language barrier. They don't have the skills to communicate it. And like they live in the farms around town, they don't have the access to drive. They used to come to town just once a week to do some groceries or shoppings. And it was the time that I catch them. And I could see the really need they have someone to support them. And I'm so happy that I've been that person to support them in this pandemic, because they don't have any idea where to go. But at the end of this story, they already been working hard. They went back to Mexico, some of them with 1 vaccine, some of them with 2 doses, and now they coming back. In this long or short story, it depends on how you can say it. Tasha support us to get the QR for at that time they need to travel. And they been back to Mexico safe. Really proud to have Canadian vaccines. And then now they coming back in March to Canada with those 2 vaccines. And they waiting to have the boosters. Some of them, they just have Mexican vaccines, but Stasha keep working with us to support them and just get the vaccines in Canadian ones. What can I say? This story is like a movie, a short movie. And my conclusion is like, there's a lot of people around us that they need support, especially when they don't have any English skills. And the sad thing about this is that companies, the farmers, the owners, they don't care about them. They only are focused on the job to get the food, the flowers, but they don't really care. At this time, I have a challenge because one of the farms that I'm working with, it's May, and they have people who came in January, and they don't care to vaccinate those people that they don't have the Canadian ones. So this opportunity that I have to be part of this health group give me the chance to share information about vaccines, places, where to go, how the vaccine works. One of the questions that I remember that I asked to Stasha and Sean, it was like people, they don't, especially the temporary foreign workers, they don't want the vaccine because they thought they will have a chip in their body. And all this kind of information was clarified, just having every Tuesday these meetings with all the team and share the information with all of them. So I think for this opportunity, there's a lot of things that we have, or we need to work on it, especially with the people that it's seasonal as a temporary foreign workers and they don't have this English skill. Thank you so much to all of you. Stasha, thank you. There's no words to say how we really appreciate your job. There's the video that I share with all of you, that kind of work they do, how they spend 12 hours standing, but finally you have your flowers in your backyard or in your place, and there's the Mexican power. So thank you for the support, and it was a really nice experience. Thank you.
Thank you very much, Dinora, for sharing your experience with us this morning, as well as all the work that you did. And I can't imagine how thankful that the temporary foreign workers that you worked with were appreciative of your connections and your work and your advocacy for them and being able to be their voice. So we all appreciate that. And thank you for sharing that experience with us this morning. Wonderful. Thank you very much. And again, we'll save questions for the end. Thank you, Dinora. All right. Just enjoying all the different perspectives and just going back through that time and how it's affected people and all the wonderful work that people have been doing on the that we sometimes don't realize, and that behind the scenes, such as all of the presenters that we've heard from this morning. So last but not least, I would like to introduce Santosh to Messina from the Bhutanese community. And Santosh, somehow I do not have notes for you, so I'm going to ask you to please introduce yourself to our group this morning.
Thank you. Good morning, everyone. Can you guys hear me? Okay,
Yes,
Yeah.
Santosh, we can hear you.
okay, all right. I would like to share this slide. And you can see my slides now, right? All righty, thank you. Well, before I start, I want to say thank you to Laura and Stasha and the whole team for providing me with this opportunity to share my experience. Before I say anything, I just want to make it clear that my intention today is just to share the experiences, especially my experience, but not to blame anyone. Or you know what, maybe I'll leave that up to you to decide what you think of who and who you think responsible for what. So let me get started here. So my name is Santos Timsina, and I work for Canadian Bhutanese Society. It's a small not-for-profit registered charity organization of former Bhutanese refugees who are now living in Lethbridge. Most of our members are not a brand new to the country, but still come into Canada from refugee camps. We have a language barrier. That's the most common one among newcomers, and just the cultural differences. And some of the work that we do as the organization, we promote atmosphere for the preservation of our culture, intercultural relationship among other different communities in Lethbridge, and also we facilitate collective voices of racialized communities towards more just and equitable societies. So just to briefly go over why I think it's important to share this kind of experiences is we always knew that there were differences or inequities in our communities, but this pandemic has really exposed our existing racial and structural inequities, and we know that minorities were disproportionately affected by COVID-19. So I think it's really important that we share our experiences so that we can learn from it and help newcomers in a better way in future. I'm not new, or I'm not different than Dinora or what Tadar talked about. So most of the challenges are the same because I do work with the newcomers. But there are certain things that I want to discuss here. So if I have to start from the beginning of this pandemic, around March of 2020, the government of Alberta announced COVID-19 as a public health emergency and implemented the provincial lockdown. And as a result, there were kind of three job categories. There were those who lost their jobs and faced economic insecurity. There's those group of people who are classified as an essential workers. So they continued working, but with some health insecurity as a result. And there were a certain force of people who were able to continue working from safety of their homes. Unfortunately, or fortunately, being an organization working with newcomers and refugees, many of the people that I worked with were from the first two categories, the ones that were that either lost their jobs and faced economic insecurity, or they were classified as an essential worker and they continued working with the health insecurity. And so high rate of infection among immigration population and outbreaks in different meat plants were seen in Lethbridge, and that brought in a lot of attention towards especially the population that are working in those plants, and that mainly being newcomers with the the language difficulties and stuff. So as a result of the pandemic, we all faced so many different challenges, and some of them being, getting reliable information about COVID-19, because like Sean mentioned early in the presentation here this morning, the information was changing so much. It was very, very difficult and hard to get the exact true updated information. And what the group initially, when this first started, we had a lot of troubles making appointments for COVID testing, or the ideas of isolation, quarantine, what it meant, the close contacts. There were a lot of troubles going on, especially with people with limited language ability. It was even tougher for health workers to contact them and to share the information. So this is where we started this group. Stasha was, she's a hero or heroine, whatever I should say. She started this group with Sean being always there to pass on to the information. And so I'll talk about that in a little bit, but just to talk about some of the difficulties that newcomers faced, because they were laid off from their job and they had to stay home. Obviously, they needed some money to survive. What happens is when you're a newcomer, oftentimes you depend on another family or your friend, with many things in your daily life. And with this rules coming out from the province saying that now two families can't gather, you can't go to that house, that kind of blocked that connection, that stopped that connection. So most of the newcomer families were left with nothing but themselves and just their poor and sad stories. And I understand that there were different benefits that were put in place by the government, but not everybody has that ability to access it in a similar way. So for most of the newcomers, it was very, very difficult to access those resources. And we even got to the point, I can only talk about most of my community people. We come from a refugee camps, so we don't have a birth certificates or anything to show that my dad is my dad or my mom is my mom, other than they're here with me and I came to Canada with them. I don't have anything else to show. And there was a point where some of our members had their parents in the States or somewhere else, and they couldn't even travel because they couldn't show the birth certificate saying that that's his dad. And that was very, very sad. So we reached out to many, many places, but we don't have that capacity to change the rules or regulations or anything. So this was just one of the just devastating rules that came out, just the essentialization of travel. I don't know how these rules were made, but this was definitely not considered of, because there are people that don't have birth certificates and that can't show who their parents are. That was one of the big challenges that we faced as a newcomer, as a people coming from the refugee camps. And also just simply booking COVID-19 testings. And transportation issues. I know Tara mentioned earlier. I'm really happy to hear that she was able to, Lethbridge Family Services was able to cooperate with the city of Lethbridge to arrange that transportation, but we were not. When I initially contacted the city, they said that's not their job. It's the Alberta Health Services. And when I contacted Alberta Health Services, city transportation is not Alberta Health Services responsibility. So it was just back and forth. And only after, I talked to Stasha and she was able to help us out. She was able to send paramedics to the houses to do some testings. I even had some families, they all had symptoms. They don't have any car in the house. Lethbridge was a waiting time of 2 weeks. And we could only get an appointment in Raymond, but they had nothing. They had no way of going there to do the testing. and they had no food and nothing. It was just a sad situation, and I'm glad that we started this program to help newcomers and refugees especially. But there are a lot of difficulties, and racism. It was just especially racialized communities became the target because of the outbreaks in different work plans. That where the minority communities were working, and even some of our political fever, especially our MLA from the East Side, said that socioeconomic factors, multi-generational families, and the number of people for whom English is a second language are contributing factors for the growing rate of COVID-19 in Lethbridge. I was able to talk to our MLA, and he had no basis on, he has not basis to provide support to this statement. Just because there are more people who has English as a second language does not mean people do not understand what COVID is, what are the rules. It's just that it's not provided to them in an easier way. Sometimes it's difficult. I'm not saying everybody understands in a similar fashion, but with a little bit of our support, people are able to understand. And it just, there were many different things that happened, that caused different mental health issues and stuff, not just because of this pandemic itself, but as a result of what other things that happened due to the pandemic. So some of the things that we do, what we did, so we initially started a COVID-19 assistance program that we help people with, we helped with assistance with resource access. We help people book their COVID-19 appointments, to fill out the employment insurance forms. We help people did the grocery shopping during their quarantine or isolation. We did many virtual information sessions with public health officers, being our SON and Stasha. We even created several information videos by our local doctors, especially Dr. Eric Bly. And we purchased some PPE and we distributed them to the families in need. Later, what we realized was this was not only happening in Bhutanese community, this was happening in other minority communities in Lethbridge too. So we partnered with Southern Alberta Ethnic Association, and we reached out to many other different ethnic groups, and we were able to help more than 2,000 people during this the program time. So some of the solutions that I especially felt worked better was community-centered solution. We can't depend on government for everything. We have to find a community-centered solution that's local and that's applicable to the certain population, stuff like that. And that's where this group played an important role. Stasha and Son and many other people, we were able to form this group. We were able to come to the meeting, every week to pass on the information, and that information got translated and passed on to the families. So everything worked out pretty good. And we have to create these partnerships. If we cannot do that, it will be difficult. If we start working in just smaller groups, it will be difficult. We have to unite and work as a team. That's the only way we can get to the better solution. And also we have to advocate for equitable federal assistance disbursements. Just because there is assistance by the government doesn't mean everybody can access it. And I don't know, as a result of this pandemic, this has been looked into, because it's still same. The benefits there, but still newcomer people, they can't access it. They don't even know what are the benefits. And even to this date, people who received some fundings back in 2020 are now having to pay back what they received because they applied for the wrong type of benefit. There were 5 different benefits, confusing, they were struggling and they just needed some money that time, and they applied for certain benefits, and now they're saying that was wrong kind of benefit. So they're having to pay back with the fines. And I hope this gets looked into, and something like this won't happen in future. And that's only possible if you all work together. And we have to just, communication is the main thing. Health literacy and public awareness. We have to work together to create that. And one of the things that I noticed was making testing and care readily accessible would help, mitigate those problems. And this will certainly promote safety and belongings for all. I thank you all for listening to a little bit of my story of my people and some of the people from the minority communities that faced great adversities in the time of pandemic. And I hope we can work together in future and create a better space for all. Thank you.
Thank you very much, Santosh, and again for your commitment to this group as well as to your community. And I know that that what you did was fantastic and helped your community a lot. And so kudos to you. And again, thank you for sharing that perspective.
Laura, before you go into questions, I just want to make a point. It's a team effort. I heard a lot of you using my name, and I just want to acknowledge that there are many, many people. I had the good fortune of working with the team, but there was a lot of people within public health and other teams that made the adaptations happen locally. So kudos to them, and Amanda with all the supports and lots of people involved. So just wanted to make that point.
Maybe Stasha, can you, I'm not sure if everybody on the call is actually clear because we keep referring to the COVID huddles. Can you just maybe just
explain the history very briefly? Yes. So it became apparent that information from my lens wasn't getting to particular communities, and a great opportunity for misinformation to be spread. And so I had worked with Santos and Sean in the summer of 2020, and we kind of nipped an outbreak in the bud. And thought, well, really, like Santos said, this wasn't just something unique to the Bhutanese community. There must be other groups, and invited key stakeholders who had points of connection and influence, informal influence within Lethbridge to meetings that we called community coaches. And we basically had Sean as a content expert with public health provide updates on where we were, what kind of infection was happening, or spread was happening, and answered questions, which was fantastic to have connection between experts and people who needed the information to help their communities. And so that's what happened as the pandemic progressed. We added on weekly updates with vaccines because there was staging. And then most recently about long COVID too, which we're dealing with now and trying to direct people to services and programs appropriately. So if anybody's interested in that, I do have a summary report, a process evaluation of sorts, but these folks as advocates for their community were fantastic and made such a difference to Nora, Santos, just amazing work. Thank you.
Well, if you don't mind, I just want to mention that, well, everything that I shared, it was not like a really bad thing. When we had the opportunity to got the vaccines for these guys at the exhibition park, it was like a party. The nurses, that team, they were really happy to support them, and they were really happy because they have a really good muscles. And when they applied the shot, it was like a wow, they worked really hard. So as the same way they enjoyed and they know that they care about this pandemic, at the same time, your team, I mean, the health team, your team, you showed all the information were a huge support for them, and they're really thankful. In behalf of them, thank you so much.
All right, thank you. And a couple before we've done well with time. It's 10:20. We will have time for questions. Again, I just want to, I know that there's people from the health working group and want to again thank Stasha for the chair of that, and also Lindsay Schwab. I hope she's still here. She was instrumental in helping with this website, or sorry, this webinar this morning. So thank you, Lindsay. And I have a signature. If you've gotten an email from me, it says, "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has." Margaret Mead, who is a well-known anthropologist, and when I listen to, all of the commitments here and all the work that all of you've done, it just brings that home for me. I'm as the LIP coordinator, I'm going to just use this opportunity to plug another project that we're doing that's actually tomorrow. I'm going to put that in the chat. It's our employment working group is doing the inclusive workplace, addressing racism and discrimination in the workplace. We have a panel that we encourage you to come tomorrow. Again, we have an afternoon group from 1 to 4:30 for employers and service providers, and then we have a session in the evening for newcomers or anybody who wants to join us. Employee rights. We're going to be talking about occupational health and safety, and also overcoming challenges of discrimination in the workplace. So very timely for this discussion. So we've got a few minutes. I'm wondering if there's any questions for any of our speakers this morning. You can either put them in the chat or put your hand up. Oops, I'm saying in the chat, yes. If I can see the chat. I have, if there's no questions, I actually have a question for Sean, I guess for all of you. And my question is, I mean, this came upon us. Sean made a really good point that, it was coming. We knew kind of it might happen, but it kind of, it went on us quite rapidly. But Sean, what would you do differently, or any of you? Looking hindsight is 2020. How would you approach it? And we hope that this doesn't happen again, but it might. But
Yeah.
but any and you all shared learnings that you had. But what would you do differently, Sean, if you had the ability to do that?
If I can go back and talk to Sean of 2019 and tell him what was coming down the pipes towards him and his colleagues, what would the guidance be? Good question. Well, one thing for sure, and I was just kind of even having some follow-up conversations over the last little bit here, was having that local context. I knew of different groups that were out in the Lethbridge and in Southern Alberta community, but we maybe weren't as connected as we needed to be in some cases. And what we identified very quickly, because of we've known social determinants of health for a long time, but when we saw just how those groups were impacted, and we talked about the processing facilities, just the work environment of specifically a meat processing facility where you're close quarters crammed together. You're doing long shifts. It's uncomfortable work. It's very physically intensive work. Those people were at a substantial risk. And we've all known, I've said this before, as we look at the situation that happened in Brooks, we've all known for some time that there was a potential dynamite stick sitting there when you have new Canadians who are not given great opportunities in terms of employment. They have opportunities to work at the slaughter facility. but they might not be able to get full hours. So they have to work multiple jobs. We have multiple families living in small, cramped housing. And you're putting all the components of a recipe together for a bad mojo to happen. And I think some of the conversations around addressing our inequities in advance and trying to get more of that political will, I think we could have seen what was coming down the pipes and try and put greater emphasis on that, and trying to get greater political will to address those systemic problems that we've that have been going on for a number of years. I think that would have definitely reduced the impact that we would have seen to a number of our communities, and being able to be prepared in advance to have that effective communication strategy and tools to really focus in and hone in on those target groups. The other thing is that whole misinformation piece. That caught me off guard. I didn't realize just how prevalent that was. And if someone would have told me back then that, you know what, the vaccine will be available, but you will have to pay people to try and take it, that would have just never crossed my mind. In all honesty, in my mind, I was going into this process like, yep, we need to do this, and everyone would be like, yes, we'll absolutely do that, and everyone would be on board, and everyone would be supportive, and everyone would help out when the vaccine's available. Yep, we'll get on that. We'll get the vaccine. When we were playing through planning and developing a response, that's in my mind, and I think a lot of people are framing their response for that regards, that there'd be a high degree of compliance and that everyone would want to get the vaccine. And then we come into this world now where we have misinformation that is leading people away from the measures that we would have been seeing to help stop this pandemic. We've seen the rise of of some of the the trucker convoy and different activities that was just something I don't think I had foreseen going back to 2019, that would be as significant an issue as it turned out to be for us.
Thank you for that. Yeah, it boggles my mind, some of the things that came up. But again, those are very good perspectives. I'm looking through the chat here. We have 2 minutes left. First of all, is there any of the other presenters that would like to address that question? What would you do differently? Or what would you have done differently? Hopefully it's in the past tense.
Past tense. If I had a magic wand, I would have unplugged social media. And really, I think, I've always long thought that addressing health equity is the metaphor of cracking the nut, top-down policies and local community action. And we certainly, I think there was a little bit of deer in the headlights at the local level and trying to figure it out and reorganize. And this is my perspective, but we know that community leaders have significant impact, and engaging with them, at the start. There certainly is a formal system, the instant command system that's used by Alberta Health Services and governments and others, and, in terms of organizational response, but reaching out to communities where people live, work, and play, I think is essential.
All right. Any other last comments or thoughts about this important subject and just our walk back through the last couple of years? Yes, I definitely hope it's past tense. Somehow I doubt that, but Denora, did you want to say something?
Well, I just want to say thank you again, and that we're really lucky to have this opportunity and to meet Stasha, Sean, Laura, all the team that it was behind scenes. And it was every Tuesday for almost 2 years. 9 o'clock, having information ready and just asking questions, supporting different communities. Yeah, we're lucky, and thank you so much. It was an amazing experience for me as an immigrant. Thank you.
Thank you for that, Denora. So we're at 10:31. So again, thank you very much for all of you who joined us this morning. We will be hopefully putting the webinar on our LIP website for availability. We'll send you out that information. And thank you again for all of you that presented your perspective. I think you've really opened some minds. I see that in the chat. And again, Sean and Tidor and Denora and Santosh, thank you very much. And thank you, Stasha, for helping putting this together, as well as Lindsay and the other team members. That makes me feel very proud to be part of a community that cares so much about their individuals and of newcomers. And I really appreciate all your help. Anything last minute comments, Stasha, or anyone, before we say goodbye?
Thank you.
Thank you so much.